Speed, pace, momentum, velocity. Our world is increasingly fast and our culture is immediate. Everything moves quickly. Moving your money shouldn't be any different. With Gravity, you can buy and sell Bitcoin instantly. We're building the Bitcoin bank of the future today.
Hello and welcome to another episode of CryptoTime. My name's James Coughlan and I'm joined with my usual co-host, Antonio Shillingford. How are you today, mate?
I'm doing rather fine. How about yourself?
Yeah, very good. As always, looking forward to kicking into what's been bouncing around the crypto space over the last couple of weeks or so. When we do kick in, I think it's going to be quite interesting to start with something that we've already touched on before, which was actually around EHR data, because I think the capacity of what they're trying to do means a massive message in terms of what capabilities BSV has to offer. And not only that, but the real world idea that they have that they can actually implement right now, I wanted to go in a little bit more detail into. So without further ado, we'll kick straight into that. And if we get a bit of time, we'll run into a couple of other little parts. All right?
Yeah. And talking about that, to be honest with you, it actually makes sense because we've got our epidemic at the moment, don't we?
We do indeed.
Coronavirus.
We do indeed.
Which we'll touch on as well.
Yeah. So as I said, let's kick straight into the episode and let's have a look at the information. So we had CoinGeek.com come out with an article relating to EHR data after their speech that took place at CoinGeek. And the title of this was EHR Data Partners with nChain to Migrate Healthcare Data to BSV. I think it's a great idea. I think it makes a lot of sense. And it's not, for example, a company that's out there that's turning around and saying, look, we think it'd be great if we approached national health agencies and all the rest of it and turn around and said, would it be okay for you to give us the data for us to then input onto the blockchain? This is a real world company that's out there doing this already when it comes to the space. So they have all of this information, all of this data, and all it really requires now is actually come into a space where they can place it on the blockchain, which I find very interesting indeed.
Yeah, and if you look at, because of course we've spoken about this before when we done our CoinGeek special.
Yep.
But we was talking about how the health industry is pretty much compartmentalized.
Yep.
So you have different GPs that hold their internal records. No information is shared. So just to bring it into a reality, as just to bring up a situation, perfect example of this coronavirus.
Yep.
So we have multiple different countries catching mass infections of it. It's just spreading everywhere.
Mm-hmm.
Now, we know that they've done case studies in pretty much all of these different countries. And I saw on the papers yesterday that they were trying to ask people to come in. They'll pay these people to infect them with the coronavirus just to see how it plays out.
Yeah.
So doing our case studies.
Yeah.
Now, if we was in a situation where all of this information wasn't compartmentalized, we'll be well prepared, very well in advance for any situation that happens because we'll just use their case studies and of course implement it here.
Yeah, it makes total sense. And I think the whole point to it is that it makes it very much possible for individuals or companies out there to start sharing this data. At the moment, it's not a situation where somebody's trying to come up with a profitable drug, which is going to make a lot of sense to them, right? It may make a company profit, fine, right? But the whole point to it is at the moment, the whole world, including Trump signing that huge bill, was it 8 billion or something you were telling me this morning?
Yeah, it was around that
figure that he managed to raise, which is obviously going to go towards this, right? This is a global effort now. This isn't about, for example, some pharmaceutical company benefiting off the back of it. Like I said, I'm sure there'll be some profit for someone to make out there, as there always is. But at the end of the day, what we really need to do as a world and as a global entity, we need to get together and we need to actually solve this issue. Now, if we were in a stance where we had this on the blockchain and we also had reports and actual detailed analysis of everybody that had been infected, it would be a lot easier and a lot seamless, in terms of transferring this information to actually make it more possible for us to come up with a scenario of actually curing people that have it. Now, that is very much possible using the blockchain because that data would always be accessed by people that have been enabled the access route to it. And I think that's very key, is that people are able to still have that privacy, not anonymity, but privacy when it comes to their records, and they understand who's viewing them and what's going on. But when it comes to situations like this, it's going to be a lot easier for these large pharmaceutical companies or governments that are out there trying to make these solutions around these problems actually go ahead and make those things happen. And I think that's very powerful. One thing that I wanted to say as well was just a couple of points out of the article from CoinGeek, unless there was something you wanted to add from what I've said first.
Yeah, so I'm sorry to take you completely
No,
off.
that's all right. I could see you were looking like you wanted to say something there, so I thought I'd kick you back in, mate.
But so on this situation, and I know I'm taking you way off track, but I think that it is a perfect scenario to be addressing.
We do digress, people. That's what we like to do on this show, is digress. And Antonio's about to take that left-hand path when we were always talking about going right. Go on, mate.
So the situation with the coronavirus. Yeah. Right. Now, of course, I know it's not a laughing matter, but so from the information that I've managed to obtain from just doing general research is that on these previous case studies is you infect someone and then during that time period it's 2 days and then that person is highly contagious.
Yep.
Now that person may not have any symptoms whatsoever until 2 weeks time. So there's a time period between the 2 days and the 2 weeks that you're highly contagious to the point where like the air that you're breathing and air that you're breathing out is also contaminating other people, where you have absolutely no idea that anything is wrong with you, that it could just be just any form of general cold.
A stupid way of putting this, there was a person on the train this morning that had terrible breath, right? They must have been standing at least 3 meters away from me, right? And that smell was hitting me, right? So it just shows you, right? Airborne is no joke, yeah? They're 3 meters away, and if that smell's hitting you, you know that airborne problem is also hitting you.
All the time, prevention is a lot better than the cure. So we have this information, we just haven't got the means of accessing this information at will when we need to of course analyze all situations that are going on around the planet. Everything in terms of information is compartmentalized, and this is a perfect real world scenario that proves that.
EHR Data partners with nChain, as we said, to migrate healthcare data to BSV. EHR Data Incorporated has partnered with nChain to digitize medical data and for the first time give patients ownership over their healthcare data. The Texas-based company is a subsidiary of National Health Coalition, NHC. Just made the groundbreaking announcement during the CoinGeek London conference. It will work with nChain to migrate. Now, something that I thought was really cool from this is, what does it mean? Something that we keep on hearing out there, and as we addressed multiple times in our last episode and also episodes in the past, is about people going out there and building stuff which is actually going to have transactions going through the system. Because we've got the halvening coming up. We know that actually BSV right now has got a low price point, but actually has the capacity to put lots of transactions through its network. That is how miners are going to earn the actual funds from this space. Now, with that being said, what's going to be very interesting is companies like EHR Data, not from the fact that it makes it better from a healthcare perspective, but also building on the network as a whole. What they have said is, obviously, if they were to take all of prescriptions and all the rest of it and put it actually on the blockchain itself, it would be very interesting, because we could be talking about over billions of transactions that would go through the network every year, which is exactly what we need to see right now to help support the network and see it move forward. And the fact that nChain have made that partnership with such a large company such as EHR Data, and EHR Data do not just see this as some sort of fad, and it actually improves the operation that they have right now, is exactly the sort of thing that we've been talking about needing to happen in this space for a long, long time.
Yeah.
Instead of, for example, that stupid crypto kitties or turtles racing across the screen or whatever it may be, we now have proper applications that are being built on top of BSV, which are going to change people's lives for the better. And I think that's a very, very powerful statement to actually end this episode on, if there isn't anything else you wanted to say to it.
No, I'll just add one extra bit. With EHR Data, I'm just interested in monitoring their progress.
Yeah.
Because, of course, we know that things are not just binary. There's a lot of politics involved, especially when you're in the healthcare industry, especially when you're in the US, and not just that, dealing with different. So, of course, you'll have Florida as one, then dealing with a completely different state on how they will manage to merge those relationships.
Yep.
That will work as a perfect test bed for then rolling it out globally, if of course those are in the plans.
Yeah, and I think, like you said, that makes sense to wrap up on that side of things. As always, guys, thank you so much for watching this episode of CryptoTime. If you are enjoying the content that's coming from us at the moment, please obviously hit that comment section up. Let us know what the opinions are in relation to EHR Data, nChain, and what's been happening around the space. But as always, guys, if you are enjoying it, please hit that like, subscribe, and notification button so you always see the latest and greatest coming from us. Thank you so much. Bye for now.
Peace and love.